Endemic bladder vesicular calculus stone. So 10 to 20% of the urinary stone is a bladder stone. Once upon a time, if you recall your days of undergrad, now the surgery exam used to start with an X-ray, big stone in the bladder, and child has little bit renal impairment, hydronephrosis, and all this and that, CKD, whatever. Those are the worst possible days. So now still they exist. 10 to 20% of the renal stone. Now. These things are more common in the Asian nations, in under resource poor nations, because people eat plenty of cereals only, and then they have less fluid intake while they walk in the hot humid climate, that is dehydration, and then so idiopathic issues are also there, and so these children or than adults, they have abdominal pain frequency because the bladder is being occupied by a stone, big stone occupying almost whole volume of the bladder, and when it obstructs the internal meatus, you have interrupted urine flow called staccato urine, and you may have suprapubic pain, you may have dribbling, may have other obstructive features, and and you may have CKD. Finally, so these stones are calcium ammonium phosphate, and infection is frequent. UTI obstruction, hydronephrosis is frequent. So they are being investigated by a flat plane X-ray and KUB and your with the postpartal residue. Ultrasound is useful. It tells you the stone, hydronephrosis, and bladder diverticulum, triangulation, fascicle, all this and that. The treatment of those cases, small stone may pass, but the bigger one, as I said earlier, and they need suprapubic cystolithotomy.